A surprising report on suicides today. The Centers for Disease Control said suicides are now the 10th leading cause of death in this country. In 2010, more than 38,000 Americans took their own lives, and that is nearly 5,000 more than died in traffic accidents. But what is really interesting is a big increase within a certain age group. And here's Dr. Jon LaPook.
For 25 years, Noel Cunningham ran a successful restaurant in Denver and several charities. His wife Tammy says he was full of life.
Noel was a huge, amazing personality. He was like a shooting star. He could make people feel as important as ever.
Then, in December of 2011, at the age of 62, Noel Cunningham committed suicide.
And there was some depression, but that had been off and on for a little bit, so I didn't think a whole lot of it. And he started to kind of close down a little bit with a lot of people.
Today, the CDC reported over the last decade, suicide among middle-aged people jumped 28%. The biggest increase among men occurred in those in their 50s, where rates jumped almost 50%. Among women, the greatest increase was in their 60s, rising nearly 60%. Overall, men are still 4 times more likely to commit suicide than women. Psychologist Kelly Posner from Columbia University Medical Center says suicide has become a public health crisis.
Why do you think we're seeing the increase?
Well, we've had recent economic downturns. The war is winding down, so we're seeing a lot more of increase in veterans who have, 21 suicides per day.
The report also noted a rise in intentional overdoses associated with widespread access to prescription painkillers.
It's never one reason, but a combination of all of those reasons could absolutely be the reason behind this increase.
This week, after one last dinner, Tammy Cunningham closed her husband's restaurant. She's trying to leave unanswerable questions behind.
I was stuck in that why for a few months, and all it did was bring me down. There are so many pieces. If I focused on why, I wouldn't be able to go forward in my life.
The stigma of depression often prevents patients from seeking help. Dr. Posner told me physicians need to be more active screening patients for both depression and suicidal thoughts.
Troubling. John, thank you very much.